Welcome to Myo360, the podcast, where we'll delve into all topics related to myofunctional therapy, including airway health, snoring, sleep apnea, TMJ, tongue ties, thumb sucking, and even bedwetting. As a myofunctional therapist, sleep coach, functional breathing instructor, and formal dental hygienist, I'm sharing stories and tips to help you identify if myofunctional therapy is right for you and how it can help improve your overall health. Are you ready to feel better? Visit the show notes and take our quiz. Is myofunctional therapy right for me? Find the quiz to see how myofunctional therapy can help you and your family live your best life. Hello, everybody. Welcome back to Myo360. I am your host, Becca Rose. Today, we're going to dive into the Toothpillow. What is Toothpillow? Chances are very likely that if you follow holistic health pages, airway dentistry pages, myofunctional therapy, you have probably come across the name Toothpillow. You've probably heard of it and know something about it. So today I want to talk a little bit more about how it works, who the best candidates are for it, and then how myofunctional therapy will help improve the outcome of that guidance device. Let's first start by saying that these are my opinions and they're based on feedback I've seen from clients, I've gotten from my clients. It's also based on overall knowledge of airway, oral facial muscle movement, growth and development. So these are my opinions. This is not considered medical advice, of course. And if you are considering a Toothpillow device, then reach out to them via the website and you can get set up and screened and start that whole process. But for our purposes, I'm going to share a bit of experience and knowledge that I have with the Toothpillow. So what is Toothpillow? The first thing to know is that Toothpillow itself is not a product. Toothpillow is a brand name. Toothpillow is, they call it a virtual dentist office. So that's the name of their office, the name of the business. It is not the actual product. And I think sometimes that becomes very confusing for parents because the way we talk about it, even when I started talking about today, we're going to talk about the Toothpillow. Everybody, including the business of Toothpillow, says it like it's a product. They talk about it like it's a product. Oh, Toothpillow, but it's actually a brand name. It's a business name. And the reason I note it is because every patient that gets a Toothpillow device may get a different appliance. Recently, I had the opportunity to listen into some professional town hall meetings that were hosted by Airway Health Solutions. And in those meetings, the founder of Toothpillow and the dental director of Toothpillow, Dr. Ben Moralia, were contributors to this conversation. There was two different like town hall meetings that were hosted for professionals to learn more about the Toothpillow. They said that there's about 18 different devices out there that could potentially be prescribed by either a Toothpillow facility, a faculty, or by a dentist that's in your area. There are two main guides that tend to be the ones that are used most often, and those brands are called MyoBrace and Vivos Guide. I have here something called a Healthy Start, and this is also one of the possible options that could be used because it is very similar to the other devices. It doesn't matter what the brand name is. They're all going to do essentially the same thing if they are coming from Toothpillow, okay? But this is my son's device. This is called a Healthy Start. And all of these devices are somewhat pliable. They have different landmarks on them that help to guide different parts of the mouth, different tissues, to help then guide the jaw and guide the teeth and guide the muscles into good function and movement. But it is not an expansion device. So there is a big difference between a growth guidance device like a Toothpillow device and a skeletal or a palatal expanding device. They do two different things. They have Okay. So tooth pillow is generally recommended for kids aged 4 to 12. The younger that you can get a child into tooth pillow, the better. This is not to say that an 8 or 9 or a 10-year-old can't use a tooth pillow. They certainly can, but the situation might be a little bit different than it is for a 4-year-old because a lot of growth has already happened at age 8, 9, 10 versus age 4 or 5. If you have been looking into the tooth pillow, the first thing you do is you go to their website, you fill out some information, and you get set up to have a screening. The dental directors, the dental faculty that is associated with pillow will review every case. They will ask you to send photos and other things that help them determine your eligibility. It's also important to know that not every child, not every case will qualify for a tooth pillow device because there's a lot of factors to take into consideration. How crowded are the teeth? How high and vaulted is the upper jaw? How narrow is the upper jaw? Sometimes, if skeletal growth restrictions are severe enough, a tooth pillow may not be the best option. Also, if symptoms are severe enough, snoring, breathing, things like that, they may be better off by using a traditional expanding device that's going to grow the airway much quicker. So, when they are determining your eligibility, they're looking at your full like medical history, dental history, symptoms, structure, to help determine if you are indeed a candidate for the tooth pillow device. All right, so let's say you qualify. You have a couple options. So you can work directly with tooth pillow virtually. This was originally set up to help people who don't have a lot of access to dental providers. Like maybe you live in a state where your closest airway provider is 2 or 3 or more hours away. So the tooth pillow platform was set up that way to be able to give more access to people who live outside of populated areas. The following of your case then continues to happen virtually. But there's also a lot of in-person. I think they said there's about 70 dentists right now throughout the country that are affiliated with them and are, I guess you could say, ambassadors for the brand. And you can potentially see those providers in person to help guide your case. There's a lot of online support groups as well, and like parent groups that talk about tooth pillow scenarios and situations. And I think it's important to mention that from all of the reading that I've done on this, from the professional groups and the parent groups, this is my guess. This is not an official technical number, but it seems to me about 50% of the people are really pleased with their tooth pillow experience, and 50% of people are not so pleased. Again, not an official number. These are just my guesstimates based on what I've observed and read in platforms online. Many people will post before and after pictures, right? So they have their 4 or 5, 6-year-old, they take pictures and maybe they show a side by side of starting day 1 and then 3 months or 6 months or 12 months. And they're always asking, can you see a difference? Does anybody see any difference? Can you see the teeth moving? Can you see any difference? And having a clinical eye, yes, I can see differences, or no, I can't. The way the tooth pillow is going to work is different for every person. Just like any other device or product that you would use, every person is going to respond to it at a different rate. I think the most frustrating part, at least from what I'm observing with the tooth pillow, is how much it costs and how much time it takes. We live in a society where we want things to happen very quickly. And I am the same way. I want as fast results as possible because we're looking to have a solution to a problem. And when we have a problem, we want that solution right now. Tooth pillow is not going to be the right now instant solution that people sometimes expect. So that can be frustrating for parents because they expect to see really significant changes like in a month or 3 months or 6 months. And you may not see those significant changes for years. Now, I'm not saying that's a bad thing because the way the tooth pillow is meant to work, it's supposed to be a guidance device. It helps to guide soft tissue into the right place. What do I mean by soft tissue? Cheeks, tongue, and then it's helping to guide adult teeth into place as they grow in once the baby tooth falls out underneath it. This is a slow process. You're guiding growth. They also sometimes call this myofunctional therapy device, guidance device, growth guidance. It's not expansion, so it's not fast. It's exactly what it says it is. It's a guide. It's guiding things into place as things start to pop up, like teeth. It has these flanges on the side that help to keep the cheeks from also pushing in and squeezing on the upper jaw. It has landmarks for the tongue to go against so that when the tongue is in the right space, it can start to get used to how to reprogram itself to swallow. But this is tricky. The tricky part about it is that if there isn't myofunctional therapy going along with it, sometimes there's compensations. Sometimes there's nasal blockage or upper airway issues. They do check for those and make sure that you can breathe through your nose and that you don't need to see an ENT first. So they're really covering all their bases to make sure that, yes, you are going to benefit from this device before you spend your money on it and then you can't tolerate it. But sometimes the parents will forego the myofunctional therapy part because it's more money. It costs more money, whether you do myofunctional therapy through Toothpillow or you do it through someone individual like myself or like a private company like myself. You really should do the myofunctional therapy because it's not going to speed up how fast the face grows or how fast the bones grow or the teeth come in. But what it is going to do is it's going to speed up improvement to overall muscle function in the throat, in the tongue, in the mouth. And that's what's going to help with symptom reduction quicker than just the tooth pillow on its own. So, symptom reduction could be bedwetting, grinding teeth. They can't grind their teeth. Some kids actually chew this thing up, but you can't grind traditionally like some kids grind their teeth. Poor sleep quality, behavioral issues that maybe mimic ADHD or concentration issues. So, the myofunctional therapy is going to help address those issues much quicker because we're working on the muscles and we're not just waiting years for this device to train the muscles what to do. We're actually doing that part. So you will absolutely have much, much better compliance with a tooth pillow, symptom reduction if you do myofunctional therapy at the same time. The other thing that people talk about is that their kids don't keep it in all night. They push it out. They fight. They don't want to. It's big. It's clunky. They just don't want it in their mouth. Even though Tooth Pillow screened you to make sure that you could breathe well through your nose and a sleep study wasn't necessarily recommended or an ENT wasn't recommended, things change when we lay down and go to sleep. So, what do I mean by that? Okay, even with this tooth pillow in place, your tongue can still fall into the throat. It can still lead to airway blockages while you're sleeping at night. If the body can't breathe, your tongue is going to push this thing out when you're sleeping. That is something that I do see quite often as a myofunctional therapist. Some sort of similar device was provided by the dentist, and they just can't tolerate it. And that's another part of this. They have to be able to breathe. And if they can't breathe at night, the body's going to get rid of it. Okay. That's good that happens because obviously you need to breathe. But the other part is, I think that we feel like we bought this device, we paid a lot of money for it, and we expect our children to be able to just do it. Oh, I spent the money on it, just do it. but it isn't always that easy. There's a lot of sensation inside the mouth. There's a lot of proprioception inside the mouth. It's hard for an adult, let alone a child, to go from having nothing in their mouth to all of a sudden having this big thing in their mouth. So please be patient with your child as they get used to it. Might take a month, it might take longer. It really depends on the child. But if you're going into it, you already know it's a long process. So a little bit longer getting used to it is not going to wreck the whole treatment plan. Okay. So make sure the child has time to get used to it. And you don't want it to be a negative experience because then guess what? They're going to fight you even more. And then they're not going to put it in or they're going to take it out the second you walk out of their room at night and they're just not going to do it. It's better to go slow, take it easy, allow for enough time for them to get used to it and comfortable with it. And then the progression starts to happen on its own. It's when we force them to do it, then that's when resentment comes in and anger. And then it's just not an good outcome for anybody, especially the kiddo, because they're going to still have their symptoms that aren't being addressed. Okay. So it's important to be patient. The other part that clients often mention is that some of the myofunctional therapy that they were getting through Toothpillow was very generic, was videos that they got sent or instructions, but it wasn't one-on-one guidance. I know that Toothpillow is working very hard to try to get more myofunctional therapists in their network so that there can be more one-on-one myofunctional therapy. But if you are not satisfied with the myofunctional therapy that you are receiving from Toothpillow, reach out to somebody who just does myofunctional therapy, someone like myself who can give you the individualized time that you need. All right. That's one of the biggest things about my practice is I'm always communicating with my patients all the time, even on the weekends. And that's really important. Parents, they need that. They love it. And it just helps with compliance with myofunctional therapy in general. Because if the kids or the parents know, hey, I have a question, or hey, this doesn't feel right in my mouth, or this is bothering me, I know I can get a hold of Becca and she's going to get back to me pretty darn quick. And we don't have to sit around and wait until someone finally gets us answered because we get put into a big queue and there isn't enough people to answer the question. The other part, I feel like just like with individualized myofunctional therapy, if you are in an area that has a tooth pillow provider, I would recommend going to that provider's office, even if it's a little bit of a drive, because anytime your case can be supervised by somebody in person where their eyes can look directly in your mouth, they can put their hands in your mouth and touch things, your face, and see how it's feeling. Again, compliance is going to be much better. The child is going to have more confidence in knowing, oh, I'm going to go see the dentist. I'm going to go see the myofunctional therapist. And it helps with accountability as well when you have the ability to work with someone local. But again, not everyone has that opportunity. And that's like really a big reason why Toothpillow was formed in the first place. So we talked about it can be uncomfortable, it can be big and be clunky. Kids take it out, it doesn't feel good in their mouth. They don't have enough time to get used to it. Parents are frustrated because they don't get answers right away. The myofunctional therapy is really generic and isn't individualized. They don't see changes fast enough. What are the good things? We talked about a lot of good things already, but this is a really good guide. It's a really good device. Okay. All of us, I shouldn't say all of us, but most of us are we've developed now with long, narrow faces, with little tiny jaws, and we don't have enough tongue space in our mouth and we don't have enough airway space. So, if we can get a product like this, you should be able to close your lips all the way around this. But oftentimes the lips will open and you'll see the device. And that's another thing parents they talk about a lot is I check them at night and they still have their mouth open. If the mouth is open, but their lips are staying in contact with this, they're still going to create a seal and it's going to eliminate the mouth breathing so they can still breathe through the nose. Other kids open so big that you can see into their mouth, even with this in there. Maybe half of it is hanging out. So that's still a low tongue posture issue. That's where the myofunctional therapy comes in to really help guide the efficiency of the device. Okay. If we can get this in there, we are encouraging really good development, facial development, tongue development, soft tissue development, teeth guidance. And in some cases, having this at a young age can potentially reduce like the severity of braces if they were needed. Is it going to take the braces conversation away? No, probably not. But as kids are developing, if it's seen that they have very crowded teeth, baby teeth, we already know there's not going to be enough room for their adult teeth. And as they continue to grow around a really narrow and crowded mouth, ortho cases tend to get then more complex and more expensive as the child gets older. So this is a way to not only address airway issues, breathing issues, and tongue issues, but to potentially reduce how complicated a future ortho or a future expanding situation may be. If your child uses this, are they still going to need like an expander down the road? Yeah, maybe, but maybe not. Again, it really depends on each individual case, the structure, genetics, all these things have to come into play. But when it comes down to it, there's nothing negative about the tooth pillow and helping to guide airway awareness, body awareness, tooth guidance, all the things I've talked about already. But it will be more effective when you can address the muscles at the same time. Now, the knee brace is not going to do the same thing like a tooth pillow device would do, but the point is that you can put a brace on a joint on your knee, and that's great. It's going to help support it, but you need to do physical therapy or some sort of muscle therapy if you really want to see improvements. So you could wear the device, but if you don't address the muscle function, the device, takes a very long time to do its job, or it just becomes a crutch or a band-aid. And we definitely don't want to see that happen with kids in airway issues because airway issues are severe. We're talking about snoring. Breathing is challenged at night. Challenged breathing leads to less oxygenation to the brain. Development can be stunted. So you don't want to mess with airway. You want to make sure that you have good airway space. But do the therapy with it because there's no tool out there that's going to take away all the problems on their own, regardless of what part of your body you're talking about. You need to have like complementary therapies to work together to get the best outcome. All right. So in Wisconsin, we have a tooth pillow provider. She's about an hour and a half away from where I live, and we work together to try to help these kiddos that are wearing the tooth pillow and trying to get airway guidance and growth at a young age. So I would love to talk to you more about doing a myofunctional therapy evaluation or connecting you with a dentist who can provide and supervise some of these products. But keep in mind that there's a lot of dentists out there that maybe aren't tooth pillow doctors, but they have similar options in their office that might be worth looking into. Reach out to me and I can connect you with other dentists who do similar products already, just not under the tooth pillow name. There's a lot of doctors out there. Okay. So reach out if you have questions. I hope that this episode was a bit informative and gave some information, general information about what tooth pillow is, somewhat how it works, and what the pros and cons are. Really, it comes down to your motivation, not your motivation even, but the child's motivation and what their temperament is. And are they pretty tolerant to things, or does it take them more time to get used to things? Either way, it's not a bad option to start with a tooth pillow or something similar, but get the myofunctional therapy involved and be patient. It's a long process. This is not quick. All right. So hopefully that helped clear up some answers in an understandable way. If you have questions for me specifically, please reach out. Hey, did you know I have a quiz? In the show notes, there's a quiz to take if you want to have more information about is a myofunctional therapy a good option for myself or my child. So check out the show notes and take the quiz. And then, as always, you can visit my website to schedule a free discovery call where we can talk about your child's case or your case a little bit more detail, free of charge. And then it gives us a time to just connect and answer your questions. So thanks for listening, and we'll catch you next time.
And now for the fine print. The information presented in this podcast is for educational purposes only and should not be taken as medical advice. We recommend consulting with a qualified healthcare professional for any questions or concerns you may have regarding your specific health condition.